Hey, I got a question for you. What about my pills? You know, my mother takes pills, I take pills, my brother takes pills, and if we don't have our pills, we can get in trouble really fast, have seizures, have anxiety attacks. What do we do about the fact that if an emergency happens, I mean, depending on the emergency, it could be a hurricane, it could be flooding, it could be anything. What do we do about our pills? How about that?
Well, hey, that's a pretty good question. I thought we'd talk about pills this week. The standard idea as far as pills that you need to stay alive and in case there's an emergency is anywhere between 30 to 90 days. It would be a good idea to go ahead and get with your doctor and see if you can get an extra supply of the pills that you need to stay alive. If you can, get 90 days. 90 days is a good thing to have. If you can't, minimum-wise, try to get yourself at least 30 days. As far as regular pills, stuff that's not as far as life-threatening, well, just stock up with what you think is necessary, such as pain reliever pills, medicine, the daily, everyday stuff that you want to deal with. But as far as your life and death pills, what you need to survive, 30 days to 90 days. That's what I would recommend.
Hey, I got another part to my question. What about first aid for my household? I got quite a few members of my family. We're different types of people, and I need to know what kind of first aid, first responder materials that I should have in my house. There's so many things to buy, so many things you can get, and I really don't have much money. So what do you got to say to that?
Well, I think I got a lot of things to say to that. Now, as far as first aid and first aid materials in your household, I think the first thing you should start with is a basic first aid kit. I mean, there are hundreds of thousands of first aid kits out there. I would get whatever you can afford. For me, I can afford a $10, $15 kit. It has the basic stuff, bandages, cold suppressants. The one thing I really like in the first aid kits is these little pouches, which is the little cleaning towelettes, sting relief pads, and of course, Providine iodine prep pad. Now these things are great to have in your first aid kit, and also if you don't use them all, take them out, put them in your go bag, put them in your prep bag and your bug out bag, because they're really light and they're really awesome. But these things will have the basic, Q-tips, everyday stuff. Now obviously a first aid kit is just that, a first aid kit. Now, depending on how much money you can spend on it, you're not going to have everything you need. Now, in my household, I got a lot of old people. I got a young person who's high-functioning autistic. I have somebody who doesn't walk around very much. None of us walk around very much. And I'm partially disabled. So for us, we bump into things, we hit things, we get scratches. And my mother's also kind of has a little bit of a blood thinner. She takes a lot of pills that make her blood thin. Okay, so I have to worry about her bleeding a lot, and even in a basic scratch. Now, what do? What is the most important thing you want to be afraid of? And that would be infections. Okay, you need to make sure that you have some products or some materials that will protect you against infections. Now, the first thing I got here is called Dermaflast. It is a pain-relieving antibacterial spray. There's quite a few of them. I like this one because it has 2 active ingredients, along with the benzocaine, which is a topical analgesic. I can't even say that. Analgesic. There you go. And a first aid antiseptic. So it has 2 active ingredients instead of just a basic one. And this is something that I think is quite important to make sure that any of the scratches, any of the problems you're having when you're bumping and knocking and getting cuts, you can sterilize. The other thing I have is a full bottle of iodine. Now, iodine, we learned in the military, was really good. Plus, you have the little iodine packets in here. They're very great for stopping any antibacterial stuff, any bacterial stuff on your skin, around your interbiotic cuts. You can clean with them. You can take a pad and use this to wipe it off. any way to make a more sterilized surface in case you had to, let's say, get serious and do cutting or whatever. But I'm not going to get into that. That's for another show.
What about Neosporin?
Well, yes, Neosporin is a good thing to have. In fact, Neosporin cream is something our parents usually had all the time. I know my mother did, and I'm sure that the person who yelled that out, his mother did too. Now, in moving on, as far as after you've sterilized your wound, you've protected yourself from infection, how do you keep that wound or that problem from getting reinfected? We constantly move around. We're constantly going to go outside. We're going to get dirty. So we got to protect those wounds. Okay? My big thing is that I like to have a lot of bandages. I have surgical bandages from Walgreens. I have other surgical dressings now because they're sterilized. I also have gauze sponges that you can get from First Choice Medical Supply. You can use these to clean the wound around the area. Get the main stuff off before you do the iodine spread on it. You can also use these little gauze pads that I have here to use it for spreading the iodine on it. Also, after that's done, you then put there onto the pad and make sure you cover it. Cover it quite well. I have conforming gauze bandages that you can wrap around the area that you put on, such as your sponge. You know, you got it on here. You need to wrap it around using your different tapes. Okay, then you have I even have for large ones, so I can have around my actual legs or maybe even around my torso. If I get a cut here or there, I can protect it. Now, these things are really good as far as in case you have something that leaks, let's put it that way. My mother gets these scratches or gets these little things where she actually has water that kind of comes out of her legs because of her lack of circulation. So I got these gauze so that you can wipe them up. You can use the iodine to sterilize the area. Then you can wrap it up around with the sponge on the conforming badge. And then the final thing I like to do is use this stretchy conforming wrap. It's really good. You've seen probably a lot of nurses and that if you ever deal with any nurses. What it does is it actually attaches itself to itself. When you wrap it around, it likes to stick to itself really well. So there it is. You know, it doesn't come off. It sticks to itself really well. I would suggest getting a couple of these because you're probably going to have to change in case you have an accident or an injury. You're probably going to have to change your bandage several times in a day or maybe every other day. So make sure you have a large supply of bandages, of sterile bandages, of gauzes, of conforming gauzes, which are also from the First Choice. These are things I got from Walgreens, Walmart. They have lots of dressings. Make sure you get enough of these dressings and gauzes and everything to keep you supplied for at least, I'd say, 15 to 30 days. I mean, we're not talking about a major incident, but you want to make sure that you don't use up all your stuff during everyday use, and now you don't have anything for that emergency. I mean, like for these two items, your big spray and your that, these are used for your emergency items, and I would suggest using your first aid pouch with all the little pouches and all the little things for your everyday use. Now, there is one more thing that I personally do not have that I want to get, and that is a new product that is out there, and it is a blood clotting device. Let's say just once, because most people don't have it happen to them as far as getting a really deep cut or something that could possibly kill them if they don't get it fixed. But there were times in the military when we had it where we had to do a pressure dressing, and then we had to put a second pressure dressing. And then sometimes we even, if it wouldn't stop, the red blood flow wouldn't stop flowing, we had to put a tourniquet on it, which is the possibility of losing your entire arm because now you've gotten all kinds of complications. There is a new product out there called Quick Seal. I learned about it by just going on the web, looking through different products that I wanted to have for my first aid kit and preparedness kit. Now, Quick Clot is literally a sponge. It's a mesh thing that goes onto the cut. And even if your cut is really, really deep, it is a clotting agent which will put it on, and that will literally save your life. If you get a deep cut, that one chance in 100 that you got a deep cut and an ambulance isn't coming. I mean, even if you're not in a serious world-ending event where you have to deal with your own life and death situations, what if you just have to keep yourself from bleeding to death before the ambulance comes? I think every household should have a Quick Clot product, a blood stop, or something that clots the blood really quickly. And Quick Clot happens to be a new product that I actually like, and I endorse it, and I believe in it. They have one at Walmart now where you can get 2 pads for, you know, less than 20 bucks. So I intend to go ahead and get this Quick Clot to kind of round about my first aid kit that is designed for my family, designed for keeping us sterile, keeping us safe, and there's always room for something else. But for now, this is just a basic in-home kit that I'd like you to think about and try to get at least some of the bases that work for you, that will help you out, help your family for the situations that you get in and are related to you. Thank you very much.